What are the extrapyramidal symptoms? Extrapyramidal symptoms include movement dysfunction such as dystonia, continuous spasms, and muscle contractions. Akathisia may manifest as motor restlessness. Parkinsonism with characteristic symptoms such as rigidity, bradykinesia, slowness of movement, tremor. And tardive dyskinesia, irregular, jerky movements. Extrapyramidal symptoms are most commonly caused by typical antipsychotic drugs that antagonize dopamine D2 receptors. The most common typical antipsychotics associated with extrapyramidal symptoms are haloperidol and fluphenazine. The treatment varies by the type of the extrapyramidal symptoms, but may involve anticholinergic agents such as procyclidine, benztropine, diphenhydramine, and trihexyphenidyl. Dystonia. Anticholinergic medications are used to reverse acute dystonia. If the symptoms are particularly severe, the anticholinergic medication may be administered by injection into a muscle to rapidly reverse the dystonia. Akathisia. Certain second-generation antipsychotics, such as lurasidone and the partial D2 agonist aripiprazole, are more likely to cause akathisia. Beta blockers, like propranolol, are frequently used to treat akathisia. Other medications that are sometimes used include clonidine, mirtazapine, or even benzodiazepines. Parkinsonism. Medication interventions are generally reserved for cases in which withdrawing the medication is either ineffective or infeasible. Anticholinergic medications are sometimes used to treat Parkinsonism, but they can be difficult to tolerate when given chronically. Amantadine is sometimes used as well. Tardive dyskinesia. Medications are used to treat tardive dyskinesia. These include the vesicular monoamine transporter 2 inhibitors tetrabenazine and deutrabenazine. A 22-year-old man comes to the emergency department due to sudden onset pain and stiffness on one side of his neck. He was diagnosed with a psychiatric disorder 2 days ago and has been adherent with his newly prescribed medication. For the past few months, the patient has heard voices telling him to quit his job, and he believes that his girlfriend's parents are monitoring his sexual thoughts with a special device. He has been socially withdrawn and has difficulty showering regularly. Vital signs are within normal limits. The head is tilted to one side and cannot be straightened without considerable pain. The most likely cause of this patient's symptoms is antagonism of which of the following receptors? The correct answer is B, dopaminergic D2. This patient is experiencing an acute dystonic reaction, that is, spasmodic torticollis, a type of extrapyramidal symptom most likely due to recent initiation of antipsychotic medication. Acute dystonia can develop abruptly anytime between 4 hours and 4 days after receiving an antipsychotic medication. The condition is characterized by a sudden, involuntary contraction of a major muscle group. Other examples of acute dystonia include oculogeric crisis, forced, sustained elevation of the eyes in an upward position, opisthotonus, arching of the back with the head thrown backward, and, rarely, laryngospasm. The risk is highest with high-potency, first-generation antipsychotics, for example, haloperidol, fluphenazine. Acute dystonic reactions are theorized to result from the antipsychotic property of D2 antagonism in the nigrostriatal pathway. In the striatum, the inhibitory effects of dopaminergic neurons, D2, are normally balanced by the excitatory actions of muscarinic cholinergic neurons, M1. Strong dopaminergic blockade causes an excess of cholinergic activity, resulting in extrapyramidal side effects, for example, acute dystonic reactions, akathisia, Parkinsonism. Medications with M1 receptor antagonist properties, such as benztropine or the antihistamine diphenhydramine, help re-establish the dopaminergic cholinergic balance and effectively treat acute dystonia. Choice A. Blockade of alpha-1 adrenergic receptors causes orthostatic hypotension and dizziness. Choice C. Flumezanol, a benzodiazepine GABA receptor antagonist, can be used to treat benzodiazepine overdose. However, it may precipitate withdrawal seizures in patients with chronic benzodiazepine use. Choice D. Antagonism of central histamine H1 receptors causes sedation and weight gain. Choice E. Antagonism of muscarinic receptors causes anticholinergic side effects, for example, confusion, dry mouth, urinary retention, low-potency antipsychotics, for example, chlorpromazine, thiridazine, are more likely to cause these effects due to their strong blockade of central and peripheral muscarinic cholinergic receptors. Choice F. Second-generation antipsychotics antagonize serotonergic 5-2A, but this does not typically cause dystonia. Educational objective. Acute extrapyramidal symptoms, for example, dystonia, akathisia, parkinsonism, are due to D2 blockade in the nigrostriatal pathway. First-generation high-potency antipsychotics, for example, haloperidol, fluphenazine, strongly block D2 receptors and are most likely to cause extrapyramidal symptoms.